Hi guys, so I made a video before about how I do my at-home vitamin B12 injections, but I kind of did it on the fly and it was kind of clumsy and I missed a couple steps and it's just not very good. So I decided to make another one and hopefully this one will be a little bit better, a little less clumsy. So I've been doing at-home B12 injections for about, probably about a year and a half now. I previously mostly done oral supplementation and then occasionally I would get a shot in the office. But it was determined by my doctor that I needed to start doing them monthly at home. I've also been through periods where I do them twice monthly depending on my levels and what I need. So let's start with the things that you'll need. Very first thing is a bottle of hand sanitizer. This is the brand I like to use. It's Calstat Plus. It's not very drying, and so I like that. And so I always start by washing my hands, but then after I get everything set up, I sanitize with this. And then I also just have I make up a little kit every month. That has just whatever I need, so like one syringe, a couple of alcohol swabs, and a band-aid, and then my bottle of B12. So I'm just gonna get rid of this bottle because it has like my personal information on it and what have you. So that's how they'll come. They'll come in a regular prescription bottle, they're a vial of B12, and it just looks like this, very tiny. So that's one of the things you'll need is the actual vial. Syringe, you can buy these at your pharmacy. This is the one that I'm using. Everything's backwards. I'm not sure if it's gonna film that way or what, but you should be able to find these. I use a 23 gauge or a 25 gauge. I haven't really noticed much of a difference. I kind of just get whatever they have. Sometimes they're out of the ones I want. And then it's a 1-inch needle. So the 1 inch refers to this part here. And then I believe it's a 3 milliliter syringe. So even though most injections are only going to be 1 milliliter, it's helpful to have the extra room. And I think when you go through the process, you'll see what I mean. So this is just what was recommended to me by my nurse, who trained me how to do these. And that's another thing, is that your doctor's office or nurse should train you on how to do this at least once before you get your prescription and start doing them at home. I would suggest you take notes. I didn't, and then I kind of had to consult with my nurse later to kind of make sure I understood. And since I was only doing them once a month, I kind of forgot from month to month how exactly I was supposed to do it, and it was already kind of intimidating. Alcohol swabs, another thing you'll need. This is the brand that I use. I bought them on Amazon. I think like a box of like several hundred is $2.50 or something, very cheap, $2.50 American dollars. And then a band-aid. You'll want to have one of those. I have a fun Hello Kitty band-aid this month. And then I like to just have it ready because once you pull the needle out, sometimes you might be bleeding or you might have a little bit of the liquid coming out, and you'll want it ready. Okay, and then the other thing that you'll need, which I don't have to show you, is a sharps container, like a proper sharps container. You can buy them online. You can get them sometimes from like your county health department, or you can get them at a pharmacy. I bought my previous one at a pharmacy. It was full, so I mailed it in, and I haven't gotten one since, so I've just been taking my needles with me to my doctor's appointments and then putting them in their biohazard sharps containers. But yeah, you'll need one of those at home if you plan on doing these frequently. So let's get started. Something to remember is that B12 stains really badly. It's very bright red. I'm on my white duvet cover here, and so I've put down a towel. What I used to do when I was new at this was I would just do it in the dining room, sitting in a chair, because everything there is, hard surface that you can just wipe up. So that would be another option, is just do it somewhere where there's no fabric, no carpet. And then the only other thing I'll address before I start is that your doctor or your nurse may suggest that you aspirate, and what that means is basically once you stick the needle in, you'll pull back the plunger to see if any blood comes out, and that's to see if you're in like a vein or an artery or something, I think. And my nurse explained to me that for this type of injection, B-12 into a muscle, it's not necessary to aspirate. And it's also very difficult because blood is obviously very bright red, and the medication is very bright red, so if you pull back, you don't really, it's kind of hard to tell what you're seeing, whether it's blood or whether it's the medication. So she said for this purpose, it's really not necessary because it's not very dangerous, even if you were to happen to hit a blood vessel. So I don't do that, but obviously do whatever your doctor's office tells you to do. I just wanted to address that. So the first thing you'll do is lay out all your materials, which I've done here, and you know, remove any clothing that might be in the way. I put on some shorts so I could get to my thigh here. Most of the time, if your doctor's having you do them on yourself at home, it's going to be on your thigh. If you're having a spouse or a friend do it, they may have you do it in their arm or the gluteal muscle. So let's sanitize our hands here. And you're going to be injecting into what is called the vastus lateralis muscle. I don't know if I'm saying that right at all. I'm not an anatomy person or an exercise science person, but according to Google, that is the proper name for the muscle that we're going to be working with, and it's this muscle here. I mean, it's basically your biggest muscle on the top of your thigh. I mean, it's hard to miss, and you can pinch it, and that's basically where you're going to want to go. And it doesn't matter too much where. You don't want to go too far down where you don't really have much muscle, but you know, basically in the bulgiest part is where you're going to want to go. Okay, so next what we're going to do is swab the area. I usually do this kind of early in the process so that it has time to dry before you inject. If you inject while you have wet alcohol on your skin, it will sting because the alcohol is going to go into that puncture wound basically, and we all know what that feels like. So we're just going to do that and let that dry. I usually do a big area so that no matter where I end up going, it's good to go. Take your vial, pop this little top off here. Don't touch the top once you're there because it's sterile. I kind of gotta improvise here since I'm sitting on my bed. Syringe. Make sure that this is all the way on. This needle will actually screw off, so you just got to be careful that you don't accidentally screw it off. You can take off the cap. I don't know if you can see here. And then obviously don't touch the needle with your hands. And then you're going to want to pull the plunger back to however much you're planning on injecting, and your prescription bottle will tell you. So mine is 1 milliliter. So I pull it back to 1 milliliter. And then you're going to inject this amount of air into the vial, and that's what helps the medication come out of the vial, is putting the air in. So let's see if I can get here. Puncture this little rubber top and push the air in, and now it's naturally going to want to kind of come back on you. So you can see it's kind of coming back on its own. Then at a certain point you'll have to pull it out. Trying not to make a mess here. It's kind of hard to get all of it out if you don't have good light, so try to make sure you're in good light. I honestly can't see very well right now. Okay, close enough. Okay. So then you're gonna just want to make sure that that air at the top is out. This is where you really gotta be careful about staining something. So just push the plunger very, very slowly until you see the green part of your syringe fill up with red liquid. Yep, and then you'll get a little bubble right on the top there. Okay, now we're ready to go. So grab your thigh muscle here, that'll help you know where you're going. And then you're going to stick the entirety of the needle, the whole 1 inch, into your leg. And then push the plunger down. Don't you can release the muscle once you start doing this. Don't shove it down aggressively, but you know, you don't have to do it as slowly as you'd think. And then pull the needle straight out. Some liquid may come out. You can just wipe that away. or blood. Sometimes it'll be blood. And honestly, sometimes you'll bleed and sometimes you won't. It really just depends. So recap your syringe so it doesn't poke you while you're doing the rest of this. Yeah, now I'm getting a little bit of blood. Put your Band-Aid on. And you're good to go. And then the final step, and a very important step, is to make sure that you dispose of this properly. Don't just throw it in the garbage. Put it in a proper, sharps container. Again, you can get that from your pharmacy, or you can always just ask your doctor's office where the best place to get one is where you're at. And I think that's all. I hope this was helpful to some of you who are starting to do intramuscular B-12 injections at home. And if you have any questions, you can leave them in the comment. But again, always follow whatever your doctor has told you on how to do it. But I hope this kind of takes away some of the mystery of how at-home injections are done. Thank you so much.